My name's Eric Lowe. I'm an emergency medicine physician, and I've been working at Bozeman Health in the emergency department for 17 years now. I often say it's the first place I rotated in medical school where I noticed I didn't look at the clock. The variety, the fast pace, the not knowing what the day is going to bring continues to keep it fresh and exciting, and that keeps me coming back.
Do you have any idea what this letter may be about?
I don't. I haven't seen it. Dear Dr. Lowe, I want to thank you and your emergency department clinical team for the incredible care I received during an episode of cardiac arrhythmia last fall. I woke up on a Sunday morning to my heart racing after what I thought was a normal night's sleep. Having never experienced anything like this before, I didn't know what to expect, and as someone who's a bit of a control freak, that terrified me. I drove myself to the ED, and upon arriving, was triaged immediately and told my heart was beating over 160 beats per minute and that I was in AFib. I didn't know what that was, but I knew it wasn't good. Your team immediately got to work and explained in detail what was happening and why it was a problem. For somebody who wasn't in a good emotional headspace to begin with, I was most grateful for the time and the way they described what AFib was and what they were going to do to try to control it. The doctor came in and explained I needed to have my heart shocked back into a normal rhythm via a process called cardioversion. I began to become emotional, realizing the intensity of what was happening. Your team again stepped in with their calm demeanor and helped me understand the procedure, how it would work, the risks, and answered every question I had. A few minutes later, I was being sedated for the procedure and didn't feel anything as they shocked my heart back to a normal beat. When I woke up, the nurse told me I was okay and that the shock worked perfectly. I've never been a frequent flyer of the ED, no offense, but reflecting on my experience afterwards, I realized how incredibly lucky I was and am to have this hospital and your medical team just around the corner. Thank you for what you and your team do for our community. Thank you for being there when I needed you and for helping me get home in one piece. Sincerely, John Wells.
So when you read that and understanding the experience that your care team provided, what does that mean to you?
Very often we don't get to see people after we see them for an emergency department visit. And notes like this that reassure that we're doing the right thing and that the patient is feeling well taken care of are really meaningful.